Welcome to the Medicine Buddha Meditations. This will be the first in a series of practical meditations to coincide with our ongoing lockdowns and coronavirus crisis. A lot of people have been talking of late, finding that life under the current situation is really becoming somewhat difficult and anxious and uncertain, and this creates a lot of unpleasant feeling for people. People are finding that their own mental health to some extent is being compromised, and even people who may normally find themselves being very resilient may just find the whole situation rather wearing at times. Part of our brief on the Zen Gateway is to be able to provide people with useful practical advice, meditations, and things that they can use in their daily life, just to, as it were, to give them a little bit of an uplift, something to keep us going and to prevent us feeling overwhelmed. So the purpose of these Medicine Buddha meditations is to be able to try short periods of meditation, literally on the hoof. These meditations don't need to be done in a formal setting. You don't need bells or incense or candles or anything. You can do these outside, inside, and they're designed really for you to be able to do something quickly, almost like a sort of rescue remedy or a first aid kit, just if you need something. Or perhaps if you wake up in the middle of the night and you are having difficulty getting to sleep, if your mind is racing, then these might provide something that you can use in that moment to help you find the rest and togetherness and centeredness that you need. So this first Medicine Buddha meditation is called full body breathing. And breathing obviously is essential for life, but breathing also affects our mood. As we know, high emotional states such as fear or anger or excitement, for example, increase the rate of breathing, increases the rate of respiration. People who hyperventilate, who become overexcited, tend to breathe shallow and very rapid. And this affects our sort of body chemistry, our biochemistry, and can create a sort of spiral of affect that it can be difficult to let go of. And so using the breath itself as a direct intervention into an emotional state is probably one of the oldest forms of meditation and intervention that was ever devised. And this is why even Buddhism, in practices such as yoga, pranayama, has been used for many thousands of years, precisely for this effect. And this is what we're going to do today. For this practice, though, we're going to combine it with not just the breathing in and the out, which will be in a long, slow breath inhaling and a long, slow exhalation. It will also be combined with a visualization as well. And the purpose of this is to bring the body, which is the breathing, and also the mind, which is the thinking, into alignment so that they're both focused on the one thing. The second thing is that we're also going to combine this with our posture as well. In fact, for all these meditations, I'm going to suggest that although they can be done either standing up or sitting down, that if we are sat down, we should be sat in an upright chair, and that our back should be straight. Now, ordinarily, when we stand with good posture, the spine takes on a nice S shape. And this is the classic shape also for when we're sitting zazen or seated meditation. But as we get older, as adults, the shoulders tend to become a little bit rounded. And the spine at the top begins to develop a sort of curvature, so that the chin tends to sort of stick out, and almost the head can sort of tend to stoop or even fall forward a little bit. One good recommendation for this, whether it's for Zazen or just for these short medicine meditations, is that we should imagine that we have a string attached to the top of our skull, just the very top of our head. And as we are standing upright, with our arms down by our side, we can imagine that string just pulling on the top of our head, sort of pulling our skull just a couple of centimeters up. And as that does so, it lengthens our spine. We can almost feel the vertebra becoming a little bit more spaced out. And what's more, the chin comes in. And this is also a classic position as well for Zazen. The chin should always be just a little bit pushed in. And this reduces that curvature at the top of the spine. The shoulders go back, and those should go back automatically. So literally the only movement we have to make is to just, with that string, just lifting the skull up. If we pull the skull up towards the ceiling or towards the sky, automatically that lengthens our spine. We don't need to try and push using the muscles underneath. Just lift the neck, lift the head slightly, a couple of centimeters, that's all it takes, and we can feel it automatically lengthening the spine. The shoulders go back, and the back now has that proper S-shaped curve in it. So this is going to be the starting position for what we're going to do. We'll start with an exhale, and then we will inhale slowly. And to begin with, we could even count it in, though this isn't absolutely necessary. What is important, though, is that as we breathe in, we should feel like a wave of breath entering into the nose and the mouth, and then sweeping down the chest, down through the torso, through the hips, down through the legs to the knees, down to the soles of the feet, all in that one inhalation. We'll hold it for a moment, and then we will exhale. And quite simply, the visualization is reversed. Starting at the soles of the feet, we feel the air rushing up through the legs, through the hips, the torso, the chest, and out through the nose and the mouth. And after we've done each breath, we're just going to relax and return to normal breathing for a few moments. And in those few moments, relax. Just settle into the change, the physiological change, the feeling in the body. And then we will repeat. We will take in another breath. Exhale, and then relax again. And we'll do this 6 times. So, if you're standing up or sitting down, just begin to lift the head. Feel that string pulling a little bit upwards, lengthening the spine. Be careful of any tension in the shoulders. Lift and drop the shoulders a couple of times just to make sure that there is no tension being held in them. And then exhale. And inhale. The breath comes in through the chest, torso, hips, down through the legs, knees, to the feet, soles of the feet. Hold and exhale. Up it comes through the knees, hips, torso, chest. And relax. And inhale. Sweeping down through the body, down to the soles of the feet. Hold. And exhale. And relax. And breathe normally. And inhale. In through the chest, sweeping down through the legs to the soles of the feet. And hold. And exhale. Visualize it coming up and out through the nose and the mouth. And relax. And for the fourth time, inhale. To the soles of the feet. Hold. And exhale. Relax. And inhale. Really feel it going through every cell of your body, down, down, down to the soles of the feet. Hold. And exhale. Relax. And for the final time, inhale. Hold. And exhale. Sweeping up through the body and out through the nose and the mouth. And relax. We can try this at home, outdoors, maybe even at work, if we're still going out. But try it a few times until it becomes familiar. And then when you need it, you could use it. Join us again next week for the second in our series, the Medicine Buddha Meditations.